From Philadelphia. Dr. Mike, good morning to you, my friend. How are you?
I'm fine, and I'm better now that I'm talking to you, Jeanette.
Likewise, likewise. All right, Dr. Mike, let's get into this because I need you to break this down. COVID-19 vaccine interest among Gen Z has dropped in recent months. This is according to new polls. Obviously, it's a worrying trend, right? We're talking about variants and things going around the country. So why is this happening, and what are public health officials doing about it?
Well, we're concerned about it, and these are young people born between 1997 and 2012, not like me that was born 2,000 years ago. But the bottom line is this, that these are folks that have been told that, well, young people don't get COVID-19. They don't get sick. So many of them have the belief that they're okay. That's not the right answer. Secondly, a lot of them are really saying, look, I'm thinking about it. I want more data. And we have not done a good job at using a lot of social platforms and social media to get the message out. So those are what many experts think are some of the reasons why these young people are hesitant.
Dr. Mike, I could have sworn we were talking about your peers. The most I would have guessed is you were born in the 90s, so good to know. So I'm curious, does this affect some of the goals that we have, right, in order to get herd immunity when you have, at this point, a lot of the older folks who have been vaccinated, and yet you have this kind of stubborn group of people who refuse to or, don't know a lot about the vaccine?
Well, since the beginning of this pandemic, there's been a seismic shift in the type of folks and the age of folks that are being hospitalized and getting sick. In the beginning, it was all our older folks and vulnerable people with underlying medical conditions. Now it's younger people. Look, Jeanette, the only way we're going to get out of this pandemic is not only to get everyone vaccinated in the United States, but look at the cataclysmic things going on in India. We need to vaccinate the world so that we can all get back to a sense of normal.
Absolutely. All right, switching gears here just slightly. For all the difficulties we've had during the pandemic, from working from home, keeping that 6-foot distance, wearing masks, washing hands, all of it, there are apparently some benefits. Dr. Mike, I noticed this for myself. My husband and I, we haven't gotten sick in a long time. We're talking about the colds and the flu. I don't know if you noticed the same with yourself.
Well, I didn't have one case, not one flu patient this past year, and I've been practicing for 30 years. I've never seen anything like it. So there's a lot of discussion about this. Is this good? Is it bad? Well, it's certainly good because of mask wearing, and the pandemic has allowed us to kind of get rid of other viruses like the flu, at least temporarily. Now, there's this concept if you don't use it, you lose it, especially with young people. And I always get back and tell medical students, look at the movie War of the Worlds. So there is bacteria and virus all over the planet. And so our immune systems from a very early age are exposed to all kinds of things. And I think that down the road, you'll see a return of flu virus and all of that as we get back together. And some people elect not to wear masks. I will probably be wearing a mask next flu season in my office. I think that it just is important to protect my patients and my family. I've learned. I used to make fun of people on airplanes wearing masks, Jeanette. I don't do that anymore.
It doesn't seem so extreme anymore, right? There are certainly some benefits to it. Well, Dr. Mike, stay young, my friend. I'm sure that has a lot to do with you being so healthy as well.
Well, what can I tell? I use oil of Olay. It helps.
That's the trick. That's the trick. All right. Good talking to you. Have a good day.
Love you, Jeanette.
Love you too.